Assalamu alaikum wa rahmatullahi wa barakatuh. Can everyone hear in the back? Everybody here as well? So inshallah, we'll just start settling down and wait a couple of minutes, people finishing prayer, and then we'll start the presentation. Inshallah, we will talk about how to keep our hearts healthy, how to keep our families healthy and safe, inshallah. And we will make this more of an interactive presentation. So I won't be sitting here. I would like to kind of walk around and then we'll talk. And we would like to also leave a little bit of time for the questions and answer, for the Q&A at the end of the presentation. So inshallah, with that, we can get started. الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا علما وفقها في الدين يا رب العالمين. So there is a lot of cardiovascular awareness and awareness month and awareness week, and cardiovascular disease is one of the common things around, and it's you will see here why this is very important, other than that I have my own bias because I'm a cardiovascular physician. But cardiovascular disease is one of the leading causes of death in the United States. What is cardiovascular disease? What does that mean? Anyone has any idea? Yes. Heart attacks, right? Can't hear you. Okay. Any idea what cardiovascular disease means? What are the things that make cardiovascular disease? Yes. Right. Anything that's pertaining to the heart and vessels, that's really good way to start. It's basically conditions affecting the structures and the function of the heart and the vessels. Right? Cardiovascular. Cardio stands for heart, and vascular for all the blood vessels that distribute the blood to the body. One of the diseases that are considered one of the leading things in cardiovascular disease is hypertension, high blood pressure. Also atherosclerosis, which is the scientific word for clogged up arteries with cholesterol plaque. So, or it's called hardening of the arteries as well. Then heart failure, when the heart becomes weak and patients can have weak heart muscle or other forms of heart failure. That's also considered cardiovascular disease. Heart attacks, like this gentleman here not having a very good time. A heart attack is a devastating event. The other thing is stroke. Stroke happens when a clot transfer from somewhere in the body or formed in the carotid artery into the brain, and it causes brain damage, and sometimes that brain damage is permanent. So you can see how devastating cardiovascular disease can be. Heart disease is the number one killer in America. If you look at this country, the number one killer is not infectious disease or wars, or it is cardiovascular disease. It is heart trouble. And stroke is the number 3 leading causes of death. So it surpasses cancers, it surpasses infections, and it surpasses many other common things that you might think would kill people. Cardiovascular disease is by far, if you combined heart attacks, heart failure, and strokes, is by far the number 1 cause of death in this country. So it's very important that we are aware of it and we understand how to deal with it, and more importantly, to know how to prevent it, right? Because dirham wiqaya khayrun min qintari ilaj. An ounce of prevention is better than a ton of treatment or therapy. So the lifestyle that we choose and that we live will actually determine and be our first line of defense against heart attacks, heart disease, and strokes. And it is our responsibility when it comes to our lifestyle. This is a map of the United States of America, and that's just to illustrate the cardiovascular death distribution. And we live in the capital. We live in the middle of the highest incidence of heart disease and death. Not just heart disease, death due to heart disease as well. So with that in mind, we know that we are in an area of the country that we need to be even more aware of cardiovascular disease and how to prevent it. Heart disease has many different risk factors, things that will make people more predisposed to developing heart trouble. And there are many, there are actually more than these risk factors, but these are the risk factors that you and I can do something about. These are the risk factors that we can modify. Other risk factors that we cannot do much about are genetics, right? The things that we inherit through our genes from our parents and ancestors. Well, you can't change that. Even if you want to change your family, you still can't change your genes, right? You don't have gene therapy yet. But these other factors we can control. Smoking, tobacco use, high blood cholesterol, high blood pressure, physical activity, obesity, and diabetes. So we're going to go one by one and see what can be done and why are these things so important in prevention and treatment of cardiovascular disease, and hence the ABCs, and we'll see at the end of the talk what A and B and C stand for. Let's start with something that definitely is preventable: smoking. Smoking causes plaque, which is the cholesterol buildup, to form in the blood vessels. Also, smoking can cause clots to form. People who smoke have more tendency to have clots than those who don't smoke. So smokers are at a higher risk for heart attacks and a stroke. It decreases the good cholesterol, and it also make patients or people at a much higher risk for cardiovascular disease. The other thing is nicotine in the cigarettes and the tobacco is a stimulant. So it can actually accelerate the heart rate, and it can cause arrhythmia. And in patients who have heart disease, this rhythm issues, the change in the heart rhythm, can be fatal, can kill people. So it's really a very bad situation. Smoking is in the United States is on the average, if you go into the distribution of the ethnicities, for some reason American Indians, well, I guess they invented the tobacco smoking, right? So they have the highest level of smokers, high prevalence, is over 30%. Whites, black range between 15 to 20%. I don't have statistics for the Muslim community. So, but you can tell from where we look around that it is actually a very common problem. We ask Allah subhanahu wa ta'ala to help all of our brothers and sisters quit and kick this bad habit. The next thing that is, so this is something preventable, smoking is. The next thing is obesity, is gaining too much weight. So what is obesity? People generally who are 30 pounds overweight are at a higher risk for heart disease, are more likely to cause heart disease, even if they don't have any other issues. They're not smokers, they're not diabetics, they don't have hypertension, although obesity can predispose people to all of these things. But even if they don't have it, obesity independently is a risk factor that can cause heart trouble. And this is the map that I showed you about where the cardiovascular death, where death from heart disease occur in the United States. And this overlapping one is where obesity is more common in the United States. And you can see the correlation between the two. Where obesity is, heart disease is. And when we have in our area, in our communities, and I'm talking about the community at large, higher level of obesity, then the risk of heart disease is really significant. Here's the bad news, that we are getting, as a country, don't take that personally, we're getting fatter every year. This is the chart when you can look at your screen from 2011 to 2021. This is a 10-year statistics that's been gathered. In 2011, there was only 12 states in the country that have obesity rate between 30 and 35%, which sounds like really a lot. But now, if you go to 2021, we have 41 states either have 30 to 35 or greater than 35% of obesity. Well, that's more than 1/3 of the people that live in the state that are obese. I'm not talking about just overweight, obese that's beyond the 30 pounds that we talked about. So in the United States, if you combine being overweight, and I'll explain what that means, what is the difference between overweight and obese here in just a minute. But if you combine that, in 1970, the combined rate was about 45%. More than half of the population had normal weight in 1970. Moved to 2020, 74% of the population is either overweight or obese. So we have 3/4 of the people that are living in the United States either overweight or obese. And that is really the definition of an epidemic. And we are not only getting fatter, but we are fatter than the rest of the whole world. So if you compare the average obesity in America is about 66%, depending on the statistics. We're twice as much to have obesity than the rest of the world. And that other smaller graph right there is actually even more scary. Our children are twice as likely to be obese than the rest of the world. So we are leading where we shouldn't be leading. If you look at the United States and in top 15 countries, and that's combining being overweight or obese, amongst all the industrial or developed countries, we are number one. We have about 70 to 74%. In the world, we're only surpassed by 2 countries, Kuwait and Qatar, where they don't have much physical activity, and it's a culture of excess and abundance. And that sometimes is not really very good. So you can see we're worse than Canada, we're worse than many other countries, Spain, UK, Greece, Turkey, etc., etc. We are, again, leading in obesity. Obesity is considered not only hazardous for the health, but it's really a threat to our national economy. So it is estimated that in 2030, and these statistics are about 2 years old before all this inflation happened, so you can actually increase this number. It's estimated that it can cost up to about $600 billion a year by 2030. And you just imagine the amount of money and the amount of wealth that can be lost. Now, obesity and being overweight, where the fat in the body matters. So not just the weight and when we get on the scale, but where that fat is, where that extra tissue is. There's 2 different types that actually make a difference in heart health. One is called the apple, and one is called the pear. The apple is when you look at your waistline and above it, and if most of the obesity, most of the fat is accumulating in that, that is considered high risk, very high risk for development of heart disease. And the theory behind that is most of that fat is actually what we call visceral fat. It's fat inside the belly, around the liver, around the stomach, and around the heart. While when there is accumulation of the fat, not in the waist, not in the abdominal cavity, but in the hips and in the thighs, then the risk of cardiovascular disease is very low. So things are not equal. We can tell whether we are on scale or basically, no pun intended, if we are normal or not by something called body mass index. I was giving this talk to PVS and I told them there will be a quiz on this formula, but not really. So there is a formula by entering our body weight and our height, and it will actually give you the gender difference as well. It will give us something called body mass index. Body mass index is just a crude way, a general way of measuring whether we fall into normal or overweight or obese. But don't worry about memorizing this formula. There's an app for that. So you can download the app. It's called BMI. There's actually several of them, and then you can calculate your own BMI. So what is a good body mass index? Anything below 18.5 is considered underweight, and that's a problem not for heart disease, but for many other issues. But normal is between 18.5 to up to 24.9. Basically, anything from 25 to 29.9 is considered overweight. Now, 30 and above is obesity, and that carries the highest risk. So normal, average, the risk is low. Overweight, increased risk, and obese is highest risk. So it's important to know our numbers, to know where we stand, so we can act accordingly. Then we go into the next risk factor, which is high blood pressure. And hypertension has been dubbed as the silent killer. Why is it silent? Because it doesn't hurt. Things that hurt in medicine and in treatment of diseases actually good, because when it hurts, it alerts you that something is wrong. But hypertension does not hurt. Many people don't even know they have it. As a matter of fact, 1/3 of the entire population of this country have high blood pressure. Just imagine there's over 100 million people in this country have hypertension. But the scary part of that is 1 of every 3 that have high blood pressure, they're not aware they have it. They don't know they have high blood pressure. So 30 million plus have high blood pressure in this country, and they don't know they have it. So why is that important? Because when someone has hypertension, it changes the entire dynamic of the cardiovascular system. First of all, arteries that are exposed to high blood pressure become enlarged and thickened. The muscular layer within an artery is an amazing structure by Allah subhanahu wa ta'ala. It has layers of different things, and some of it is what called the smooth muscle. That becomes enlarged, and the endothelium of that vessel becomes dysfunctional. So that vessel not only become an issue in kidney disease, and we have some nephrologists here that can also speak about that, but also not only in blood supply, but it's also much more vulnerable to be clogged up with cholesterol and other things that may lead directly to heart attacks and a stroke. So it is a killer without a doubt. This slide shows that as we increase in age, the likelihood of having high blood pressure increases. So this is actually statistics that were performed in the United States by the National Health Organization. And it shows if you're over the age of 75, chances over 70% that you have high blood pressure. But even if you look at what we call middle age, between 45, I guess 45 is young these days, middle age like me, I guess, then it's almost 50%. Half of people my age have high blood pressure. But the problem with that is if they don't check it, they don't know it. And again, I hate to keep bothering you with these maps, but you can see the purple is the highest level of hypertension. And again, we're smack down in the middle of where hypertension is worst in this country. So invest in one of these. If you don't have one of these pressure cuffs at home, get one. It's really a good investment. Make it a Eid gift for your family, a Ramadan gift for your family, just to keep everybody healthy. Because if we don't check it, we don't know it. And if it doesn't hurt, we will not be aware of it. So it is really important to do that. The other thing is what is considered normal. And you will hear different things. Now, when we check our blood pressure, the machine or the physician or whoever is checking it will give us 2 numbers. One on top and one on the bottom. Well, the one on the top is called the systolic blood pressure. And that's the pressure in the arteries when the heart is actively pumping the blood out. Then you have the diastolic blood pressure or relaxed heart blood pressure when the heart is relaxed. That's the lowest part of the blood pressure in the arteries and in the vessel. Now, normal should be less than 120 on top and 80 on the bottom. So, someone said, well, For me, 140 is good. That actually is absolute nonsense. There is no good blood pressure for this person and a bad blood pressure for that person. There are only few exceptions. When someone is having a stroke, they need the blood supply, then the neurologist will recommend that we allow higher blood pressure to occur. But in general, when we're looking at the diagnosis of hypertension, normal is 120 over 80. Between 120 and 140 is considered pre-hypertension. So if someone is checking their blood pressure and it's 130, 135, it's not normal, but they're not yet diagnosed with hypertension. And the same thing on the bottom, if anything between 80 and 89. Now, once someone hits that 140 over 90 and above, then the diagnosis of hypertension is established and is stage 1 hypertension. If it is over 160 on top and over 100 on the bottom, that's a high risk blood pressure. That's stage 2. Over 180, you go to the emergency room. You need to seek immediate medical attention because that's considered hypertensive urgency or an emergency. And the blood pressure needs to be lowered more rapidly. Any questions about the hypertension and the blood pressure before we move on to the next one? Yes. And just speak up, please. So the question is it genetic or is it environmental? Well, it is. There is definitely a genetic component, and there's also what we call an environmental component, meaning overweight people can have high blood pressure. Diabetics, they will have high blood pressure. Kidney disease can lead to high blood pressure. But here we're talking about things that in our ability to modify and to work with. So even if it is genetic, and there is a genetic component, but there are things we can do. And the first step is to diagnose it, is to know that someone has blood pressure. And that's what this talk is emphasizing. Not how you treat it. There's about 100 medications out there, depending what your physician will be recommending for you, what would be fitting you the best. But in general, these are risk factors that we can do something about. I'm sorry, I can't hear you. So generally, the question is the systolic and diastolic, are they proportional? When the systolic goes up, does the diastolic go up? And vice versa. For the most part, it's true. But there's also something called systolic hypertension, where the diastolic is normal and the systolic is really high. These numbers still apply. So that person is still hypertensive. And the same thing with the diastolic hypertension, then also that same thing apply. So over 90 on the bottom or over 140 on the top is definitely hypertension. So the numbers may change depending, if you're yelling at your child or going through a stress or relaxing there, making tasbih. The blood pressure will fluctuate. Blood pressure is not the same every time you check it. So don't panic if you just went through an argument and you check it and it's 160. Wait an hour, sit in a chair, back supported and relaxed, and then recheck it again. So what we're talking about here is persistent high blood pressure, not if you get excited and the blood pressure go up and then it relaxes. Now, there's something called, I don't want to make this too complex, there's something called situational hypertension, where people have really significant high blood pressure when they have stress, and sometimes the stress is very minimal. If that is recurrent, then that also requires some treatment. Yes? So the blood pressure has something we call, and you're aware of it, diurnal rhythm. So, and that varies from one person to another. So some of us have higher blood pressure at night, and some have higher blood pressure when they first wake up in the morning. So it's really good if you are doing a surveillance on your blood pressure, is to check it in the morning, occasionally, check it in the middle of the day, and check it towards the end of the day, and then just see if you can establish your rhythm. And if you always wake up with the blood pressure of 150 over 100, but in the evening it's 120, then that means there's definitely reason to treat that morning blood pressure. Does that answer the question? So diabetes. Yes, I'm sorry. Is the diastolic? No, there's no one more important than the other. And actually, there was a famous trial. It actually took place right here in Memphis, called systolic hypertension in the elderly, and it shows that even isolated systolic hypertension is detrimental, and it's associated with increased cardiovascular death, even if the diastolic was fine. So they're both equally important. All right, diabetes. I'm just a little bit embarrassed to speak about that in the presence of some endocrinologists here in the audience, but I'll give it a shot. But I'll speak about it from cardiovascular standpoint. How does diabetes affect heart disease? Diabetes by itself, just the diagnosis of being diabetic, increases the risk of heart disease between 2 to 8 folds. 200 to 800% more of risk of heart disease in diabetics. And most diabetics, as probably Dr. Qureshi can tell you, they don't die because just only because the blood pressure gets too high or too low. 75% of patients with diabetes die with heart disease or cardiovascular disease like a stroke or heart failure. So diabetes is a very important risk factor. And I'm boring you with this slide, but if you put the cardiovascular death map and then the diabetes map, you will see that the overlapping is, and these are all the CDC maps, and this is CDC data that tells you where diabetes is, death occurs. We're not talking about just heart disease, we're talking about death that occurs due to the heart disease. So it is a very serious matter. Diabetes is not to be ignored, and diabetes is not to be overlooked, and diabetes needs to be diagnosed. How do we diagnose? And that's the other thing. Diabetes is getting worse in this country. So this is the map in 2004, 2012, and 2019, and you see it's getting darker, bluer. That means the prevalence that diabetes is on the rise. And this graph below that shows percentage of diabetes and diabetics, you can see that this starts, it's hard to read, but it's from 1968 to 2014. Without giving up my age, that's through my lifetime. So you can see that it's a steady increase, but somewhere in the late 80s, mid 90s, it took a sharp increase up. Why? What are the theories? I mean, of course, we don't know exactly, but why do we think that just happened in between the mid-90s and now it's taken a sky? Yes. McDonald's has been founded a lot, but that's a very good, yes. What's that? Industrialized food, it's the food industry. But what's wrong with the food industry is there's a lot of research on that. But the idea is that a specific product made its way to the American market, and it became very, very widely used. And it's invented by the Japanese, and it was exported to this country, and we took away with it. And everybody considered it a retaliation for Hiroshima. That they're getting back at us, they want to kill more people than we did in Hiroshima with high fructose corn syrup. The worst type of sugar that you can put in your body. It metabolizes on the same pathway as alcohol, and it can cause fatty liver that lead to liver cirrhosis, to liver failure, and then it is a very important in the epidemic of the diabetes. Now, if you look at a can of Coke, of the classic Coke, right? How many spoons of sugar of high fructose do you think you'll find in there?
17.
About 12. 12 spoons in one can, in one serving. So, and then if you look at your cereal that you buy in the store, you'll see that it's one of the main ingredients. If you look at most of the industrialized food, that you'll see that because it's so cheap to produce, and we are one of the leading corn producers in the world, so we have a lot of it. And then it is used till today in a very, very common way. So that's just a digression, but you can just see how diabetes continues to worsen. This chart just to show you, and if you look at that last graph, that the risk of cardiovascular disease and stroke is at least 3 to 4 folds in the diabetics, which is the orange bar. So you can see diabetics do worse with hypertension, do worse with obesity, and do much worse with cardiovascular problems. Yeah, so the question is about a silent heart attack. Maybe we'll come to it a little bit later. So diabetes, how do you check for diabetes? For the most part, if you have access to something like this machine, the glucometer, then you can then it's recommended that you periodically check the sugar in the morning. And if it is more than 110, is that still valid, Dr. Qureshi? Then it is considered an abnormal. Dr. Qureshi gave a really extensive, good talk about diabetes and diagnosis of diabetes. But for the most part, it's not like the blood pressure cuff. A lot of us don't have access to it. But it's so important to keep up with your regular physical examinations with your primary care physicians, because they can check that and make sure you're okay. And the other thing they will check is something Dr. Qureshi spoke about it during his talk. It's called A1C level. That looks at the blood sugar reading over 3 months. And if the level is more than 6.4, then someone is definitely a diabetic. If it is less than 5.7, they're not. And in between, they're pre-diabetic, and they should try to do something. And we learned from Dr. Qureshi's talk that you can actually move from being pre-diabetic back to normal, but it's so hard to go from diabetic to normal. Is that still accurate? Yes, sir. So diabetes is a very bad risk factor. It needs to be diagnosed. And again, I'm not talking about how you treat it. That will be up to you and your physician, and the cases are so different. But it's important to know that you have it, la samahallah, yani, or anyone has it, so it can be treated. The next risk factor is, again, silent. You don't feel it, you don't see it, you cannot touch it. And you can only measure it in the blood, and that's the cholesterol level. Now, cholesterol is not a bad word. Cholesterol is not a curse word. We need cholesterol. We need cholesterol to have the membranes of our cells intact. We need cholesterol to produce the important hormonal factors in our body. So cholesterol is needed, and it's also needed for bile acids that help us digest. But there are different types of cholesterol, and what we're talking about here is a specific type carried by a lipoprotein called low-density lipoprotein, which is LDL. LDL is a bad player. People who have high LDL have high risk of heart disease. And you can rarely see someone that has chronic elevation, long-term elevation in the LDL that have good vessels or good heart. So LDL, if you're not going to remember anything or any of these numbers in this presentation, remember the LDL and what the LDL should be, and that's what we're going to talk about. Why is this important? Because those small particles of cholesterol, called ApoB, that is carried by the LDL, they float in the bloodstream, and then when they find a vulnerable vessel, either due to blood pressure or diabetes or genetic predisposition, they find a way to deposit themselves inside the wall of the vessel, and that accumulation of the LDL particles or the ApoB particles can lead to something called plaque formation. And that's what we talked about, what we called atherosclerosis in the beginning of this talk. That's hardening of the artery, that's clogged up arteries, so to speak. Clogged up arteries can lead to heart attacks. So first you get a normal artery that has no cholesterol in it, and then you start having deposits, and then the plaque can progress. And if you see that volcano right there at the end of this cartoon, that's a vulnerable plaque. That's a plaque that started cracking and exposing the inside the inside components of bad cholesterol, and that can lead to a clot. And clots in an artery that is already tightened is a massive heart attack. It's a heart attack that can occlude the artery completely. So that's what we're trying to avoid, is the heart attack. And heart attacks, just to go back to the brother's question, it can definitely be clear, like what you saw in that picture. Someone is having crushing chest pain. Sometimes the pain may radiate to the jaw, to the arm. They get nauseated. They feel really sick and really bad. But sometimes the symptoms are not very typical. Sometimes it's just being more tired than normal. Sometimes it's having indigestion type of discomfort. And women have a much different presentation than men. They don't have that crushing elephant sitting on the chest. They have milder and different symptoms. So it's very important that if someone is having a problem, a sudden issue, to be checked. It's better to go to the ER and suffer through the waiting and the checkup than to miss a heart attack. There are things that we can check to see if we actually have plaque in our hearts. And this is a test that I want you all to be aware of. It's called coronary calcium score. When plaque occurs, when plaque happens in the heart, calcium comes and deposits itself on top of the plaque and on the bottom of the plaque. It kind of trying to trap that cholesterol inside, and that what causes the hardening, right? Calcium is rock. Calcium is hard. So the hardening of the artery happens because of the calcium. Most plaques that have been there for a while will accumulate some calcium. So there is a test that is very simple. It's a low exposure to X-ray. It's done through a CT scan. It takes literally 5 minutes under the scanner, and it will give us a number of how much plaque, how much cholesterol buildup, how much calcium is in the heart. If it is less than 10, it's minimal. Between 10 and 100 is mild. 100 to 400 is considered moderate. But if the score is over 400, then someone really needs to make sure, if they do the test, to check with their physician and to probably consult a cardiologist at that point. So at this test, most of the time, probably need a doctor order, but you can get it done also in many imaging centers, because unfortunately it's not covered by insurance. But the only good part about that, it's only about $100 to $125 per test for the entire scan. And the information is valuable. So if someone has risk factors, I highly recommend they invest in that test as well. This is just a quick look at how you treat an acute heart attack, and that's what I do for a living. Is you go in there, you do a heart catheterization, you look at the arteries, and if there is a plaque, you can try to take care of it. You cannot remove it, but what you can do is you push it out of the way and allow the bloodstream to occur using a balloon and a stent. And this is actually a patient that we had that if you look, it's hard if you're not used to looking at these. The darker, the fatter the color, the more blood flow. And you can see right here, there's a 90% blockage. This patient was having an acute heart attack. And this is what it looks like after the stent was deployed. The blood flow is restored. So there are things we can do when a heart attack occurs. That's why do not ignore the symptoms. If someone is in the emergency room or in the cath lab within 90 minutes, the damage to the heart is minimal. Once it's over that 90 minutes, then the damage can be permanent and irreversible. So again, quick diagnosis is very important. How do we reduce the cholesterol level that leads to all of these problems? Again, the normal cholesterol levels total is less than 200. So if someone checks their total cholesterol and it's 190, they may feel good about it, but that's really not adequate. Or if it was 230, they may feel like they're having a problem with cholesterol, but that's also not adequate. The reason being is the total cholesterol looks at the good and the bad combined. So if someone has too much good, like most females do, their LDL, the HDL can be 70 or 80, and I have patients that have 120 of HDL. Then their total cholesterol is 250, but a lot of it is just good cholesterol, and the bad cholesterol is a smaller portion. So it's the ratio between the good and the bad, but if you are to remember one number, remember again the lousy cholesterol, the LDL. You want it to be less than 100 if you have any risk factors for heart disease. If someone has established heart disease, the American Heart Association changed their criteria. It used to be less than 70. Now they're recommending less than 55 on the LDL to prevent further heart attack and further plaque buildup. How do we reduce cholesterol? Now, I said we are talking about all of the things that we can do something about to take care of. We can take the initiative. Of course, medications is important, and for someone who has a really high cholesterol, over 130, with risk factors, they need to consult with their physicians, make sure their annual cholesterol is checked, and that's the recommendation of the American Heart Association. But also, we can reduce the cholesterol with weight reduction, we can reduce the cholesterol with exercise, and we can reduce the cholesterol with the quality of the food that we eat. So things that we call omega-3 fatty acids, they're available in fish and in some nuts and vegetables, like avocado and other things, they can lower the cholesterol. Olive oil is a very good source of nutrition that can lower the cholesterol. If the saturated fat is bad player, that can increase the cholesterol. So we want to make sure that the saturated fats, the unhealthy fat, is less than 7% of the calories that we take. And unfortunately, again, the food industry, they don't care about that. They care about what's cheap and how they can market it and what tastes good. So you'll see you need to be a label reader if you bring things that are processed and you're not cooking it yourself. The other thing that can lower the cholesterol is something called plant sterols. Now, the word sterol is included in cholesterol, right? Because they have the same molecular structure, the same biochemistry. But plant sterols are beneficial, and they can actually reduce the cholesterol as well as soluble fiber. Example of that is what you see there on this slide. A plate of hummus is very, very high in sterols, and it can really help in lowering cholesterol levels. You put olive oil on it, and you eat it with some whole grain bread, and you're ready to face your cardiologist any day of the week, right? Because this is really a healthy plate. Just don't eat too much of it, right? Because calories still count. The other thing is, what kind of cereal is that? Kids, adults? Cheerios. Why Cheerios? Because it's high in sterols and it's high in fiber. It's a whole grain. And the plain Cheerios have very low sugar added. It has carbohydrate, but doesn't have added sugar. While if you look at other cereals in the market, like whatever Trix Mix, or I don't know what they call them, that they have high fructose corn syrup in the cereal itself. Salmon, fish in general, is a very good source of omega-3 fatty acids. A handful of nuts every day, a handful of almonds or pistachios or other nuts can definitely be a very good source. And then healthy vegetables and healthy fruit. So we need to know our numbers. And this is, a slide that you can take a picture of or keep it in mind. But these are the good numbers and the bad numbers of everything we talked about. The LDL is good if it's less than 100. Over 160 is really bad. The good cholesterol, if it's over 50, is great. If it's less than 40, it's not good. The triglycerides we didn't talk much about, but in general, it's a secondary risk factor, so I'll skip over that quickly. But the blood pressure needs to be 120 over 80. If it's over 140 over 90, that's bad. The blood sugar needs to be less than 100 or 110. We said probably less than 100 is the more accurate number. It's over that, it's not good. And the body mass index needs to be 25 or less. So these are the numbers that we need to remember. Yes? I know we don't want this to become a lesson on lipoproteins, but low-density So yeah, the question that Adam is asking is the difference between low density and high density. The low density particles are compact, they're small, and they carry ApoB, which is bad cholesterol, bad player that can invade the arteries. The HDL, the high density, are fluffy and big, and they actually remove cholesterol from the arteries. So they're totally different. Yeah. So stress can definitely exacerbate heart disease by doing many things. Stress produces hormones in our body, like cortisol and cortisone. And that increases blood pressure, it increases blood sugar, and it can accelerate the heart as well. So a chronic exposure to that, recurrent stress that will pump the adrenaline up and cortisol up, and it can actually damage the arteries and make them more vulnerable. So is that what you're asking? So definitely stress is a factor. And that's why when you look at what the things that is a good heart healthy lifestyle, actually that very bottom is reduce your stress level. Right? That is an important risk factor that needs to be modified. So if you want a healthy heart, stop smoking, be physically active for at least 30 minutes a day, eat a healthy diet, maintain a healthy weight, keep an eye on your weight, keep an eye on the blood pressure, keep an eye on the blood sugar, and trying to reduce your stress. Take a vacation. So again, if you look at physical activity, and I promise you this is the last couple of maps that I'm going to show. Again, the death rate, you can see in the dark red. And the dark blue is the level of inactivity. People who exercise less than others in this country. And that's why you see in our area, exercise, and I hope that doesn't apply to our community, exercise is not very fashionable. But in California, in the Northeast, and in some of the mountain areas, exercise reduces the level of heart disease, and that's well documented. So do this, walk, exercise, be active, and don't do this. So the ABCs, and I'll conclude with that. A, for avoid smoking. B is become more active. And C, choice of good nutrition and good food. So inshallah, we'll open the floor for some questions. It took a little bit too long, but I thought it was really an important thing that we all should be aware of. Any questions? Anything that, yes?
Dr. Bashar, you mentioned like the heart disease is like the #1 killer in the U.S.
Yes.
Is it within diseases or like the main cause? Like is it more than traffic accidents, more than alcohol?
Correct. It's more than traffic accidents, more than alcohol, it's more than suicide, it's more than anything else. So it's the #1 killer bar none, not just amongst diseases. Yeah. Yes. Salam, Sean. Want to use the mic? If you want. Yes, and having a defibrillator in a public place is also important because you have minutes to react if someone is having a heart arrest. Go ahead, Sean.
Yeah, assalamu alaikum, jazakallah khair. Learning how to do CPR and use a defibrillator is very important. So, shameless plug, we have an EMRT here, Emergency Medical Response Team. We're having training, and you can announce that, I must have Rahman too. We're having training next Saturday from 1 to 5 here. If you want to sign up, they're going to send out the link over the weekend, so sign up. We have 2 defibrillators here in this building, one over there in the entrance to the Nasim Hall, and one over here in this entrance down here. They're checked regularly that they're working, but it's very important that you know how to do this. So next Saturday, sign up for the EMRT class, learn how to save a life in somebody's heart.
Definitely highly recommended that you do that. Anyone else has a comment or a question? Yes. Jazakallah.
I recently moved to the States.
Yes.
And I was seeing a doctor back home. He gave me a medicine which called Forxiga for sugar, blood sugar. And since then, my blood pressure is lower than 120. That's one point. The other point, what's the difference between stroke and heart attack on symptoms.
So
And how
stroke affects the brain.
Yeah.
Heart attacks is in the heart. Stroke symptoms can be anywhere from sudden paralysis, not moving an arm, not able to talk, the face drooping, the face become paralyzed on one side. Stroke is mostly nerves, neurological symptoms, while heart attacks can be related to the heart, chest pain. You're talking about the symptoms, right?
Yeah.
Chest pain, shortness of breath, and things like that. So there are two different things because the same process, the same underlying problem, but one affects the vessels in the brain and one affects the vessels in the heart.
One more question, doctor, if you excuse me. How can we distinguish between the pain in the chest and the pain in the chest through the colon?
So that's sometimes, the question is, how can you tell if I'm having? A lot of times you can't. A lot of times the pain may radiate, and you may think, and that's one thing, and some people may think it's another. So it's important if someone is having an acute pain that's not usual, has not had it before, just go get checked. Go to the closest hospital, get an EKG, get a couple of, there's enzymes that can be checked called troponin that are very, very highly sensitive to diagnose heart attacks very early. Now, if someone had a heart attack, just want to question, what are the chances of dying of a heart attack? Someone, la samah may Allah forbid. Yes. No, it's not 50-50. It's actually less than that. Close. Yeah. Does anyone let's talk about what are the odds of dying with the Russian roulette? Does anybody know what the Russian roulette is? Right? You put a bullet in a revolver and you take your chances. What are the chances of dying with the Russian roulette? 1 out of 6. That's 15%. That's exactly the odds of an acute heart attack. So if someone is allowing themselves to have a heart attack, they might as well be playing Russian roulette. It's the same statistics.
Excuse me, doctor. My last question was about this. How come we see, more the younger people who had heart attack die more than the oldest, like 50 and more?
So number one, that's not completely true, but you probably see that. A lot of times younger patients, like in their 40s and 50s, when they have their first heart attack, and if it is in a major artery, they immediately collapse, and they don't have much of a chance. And it all depends on where the heart attack occurs. There is certain arteries that are much more vulnerable to death than others. If a heart attack occurs in a side branch or a small artery or down the stream, then most people can actually survive that. But there is something called the widowmaker, or the left main, or the left anterior descending. These are major arteries that if a heart attack occurs in those arteries, the chances of dying are much greater. Any other questions? Yes, bro. Okay. So low blood pressure is not a risk factor for heart disease. It's bad. It allows, if the blood pressure is chronically low and below acceptable limits, and it leads to what we call lack of perfusion, the blood flow is not going to the kidneys well, not going to the liver well, then that's not a good situation. It doesn't increase heart disease, but it can still cause organ damage. But high blood pressure is the only thing that can cause problem with the heart.
What could be the cause of low blood pressure?
So it could be many things. Infections can lower the blood pressure, taking too much medications, dehydration, and many other things can cause low blood pressure. Yes. Yes. So diabetics, the question is regarding the silent heart attack. Why does it happen more often in diabetics? And that's true. The diabetics have something called neuropathy. The nerves, after prolonged exposure to diabetes, become numb. And you can see diabetic patients sometimes, they can step on a nail and not feel it in their feet because of neuropathy. Well, it is known that that also can happen in the same way to the nerves that supply the heart. So pain is not a major symptom when a diabetic is having a heart attack. They can still have pain, but a lot of them don't. They just feel nauseated sometimes. They throw up. They feel like, they're having a lot of shortness of breath and many other things. And that's why in diabetics, sometimes it's hard to diagnose those. And that's why the death rate in diabetics is much higher. Yes, Adam?
Is there a quick thing that we should do if someone has a heart attack? Is it mainly just
So heart attack can be somebody who's really stable, just telling you I'm having chest pressure, you just take them to the hospital. Don't pump on their chest, right? But if someone collapses, right? We're just talking to you and they just drop. There was a soccer player that had that, recently. And that's a heart attack due to sudden rhythm problem. It can happen with the clogged up arteries. It sometimes can happen in healthy adults for electrical issues. The most important thing is to start CPR, and what Sean said, if there isn't access to defibrillator, just go ahead and put it on that person. And that's really what saved that soccer player's life, is they had a defibrillator right there, and they were able to revive him.
What about if somebody having the pain and while waiting for the EMS or reaching to the hospital, give them an aspirin?
I'm sorry.
Give them an aspirin while waiting for the
Yeah, so if someone is having chest pain, you already called 911 to come and get them. If you have an aspirin in the house, go ahead and give it to them. If it was not a heart attack, if it was a false alarm, it's not going to hurt them. But you might increase their chances of survival if you do so. Just don't give them medications that are not prescribed. Okay, don't say my neighbor had this, and don't do that. Okay, don't borrow medications for anybody. Yes.
I just want to share something. It's a personal experience. Many years ago, my dad was a pharmacist. Back in Pakistan, there was a gentleman, he worked at a restaurant, and he would come, I remember him, he would come to my dad, because we used to go buy bread from him, and he was complaining of heartburn. It turned out to be a massive heart attack.
Massive heart attack.
So, again, that if someone is having persistent heartburn, they definitely should be seen, right?
It could definitely be just a little bit of acid reflux, but like I said, heart, not what we say here is like a doctor's joke. Not every heart read the same book, right? Not every heart will follow the classic textbook description of the elephant sitting on the chest or the radiation to the left arm. Sometimes they just feel indigestion. And I tell my patients, if you have a lot of risk factors, that if you're having indigestion, you're not sure what it is, well, go get it checked out. Well, I have to wait in the ER for 5 hours. Well, it's better to be there for 5 hours and survive than to just ignore it and go to bed and not wake up, right? So it is always important if someone, especially those who have risk factors. So, for example, if someone is diabetic and hypertensive and had family history of heart disease and they start having recurrent indigestion, then that could be a sign. The other thing that could be a telltale is what makes it worse. If it happens only after they eat a pizza, then it could be GI, right? But they still need to be checked. But if it happens every time they walk, they exert themselves, they carry something related to activity, then that could be a very clear sign of possible heart disease. Does that answer the question?
Thank you.
Yes.
For your exercise that you mentioned. Assalamu alaikum. I just remembered, and one more thing. So the exercise that you mentioned, there are a lot of programs here that they do at MIC. Sheikh Fazaga is here. He's got the soccer and the volleyball. There's basketball. And shameless plug, we also have an MIC cycling group too, if you like to bike.
And I mean, different strokes for different folks. If you can play soccer, more power to you. If you're as old as I am and you're worried about your knees, walk. Brisk walking is one of the highly recommended, most effective things in prevention of heart disease and in improving the physical activity. Just brisk walking for about 30 minutes a day. If you cannot do it every day, do an hour every 2 or 3 days. Yes. Yes. Wa alaikum salam. So the first question is how non-steroidals affect heart? Oh, anxiety. Okay. And the second question? How can you manage stress? Okay. So anxiety is a type of stress. And like I was when I was answering Abu Fadi's question, that stress can be a bad player. Anxiety can do the very same thing because it's really a form of acute and sometimes it's chronic stress. So if someone has recurrent anxiety, recurrent stress, they really need to be consulting with their physician to see if they need to take something to reduce that, or if they recommend like exercise routine that can actually relieve the stress and it can help with the anxiety. The other part of the question is, how do you treat that? How do you deal with stress? Actually, one of the websites that I do recommend that you all go to if you have time, and it's very, very easy to navigate, is the American Heart Association, AHA.org. American Heart Association website, and it goes over all the things that I spoke about and also how to manage stress. But in a nutshell, I'm not just diverting the question, it says, in the counter recommendation is what relieves my stress may be different from what relieves your stress. And the type of stress that I have is different than the type of stress that you have. So the recommendation is to be consulting with physicians, and if someone needs psychotherapy or other things, they should be referred to. So it all depends. Some people relieve stress with meditation and relaxation. Some relieve stress by playing soccer. Some relieve stress by punching a bag, right? So these are so many different things to stress relief. And it's different from each one person to the other. So Jazakumullah khair. If there are no more questions, you've been more than great attentive audience. May Allah subhanahu wa ta'ala keep you healthy, keep your families healthy, and may Allah subhanahu wa ta'ala allow us to be good tools to spread better health practices in our community and in our city, inshallah. Jazakumullah khair.